I am Norman Aquino, and I am a glaucoma specialist.
I'm Nilo Florcruz. I'm a glaucoma and cataract specialist.
Glaucoma is an affectation of the eye wherein progressively there is death of the optic nerve, resulting to permanent blindness.
Glaucoma is a progressive disease. It's irreversible and usually affects the older population. Usually, or most of the time, wala silang nararamdaman. Yun ang mahirap sa glaucoma. Most of the time, asymptomatic.
You know, there are basically two types of glaucoma, the open angle type and the angle closure type. And depending on the type of glaucoma that the patient has, sometimes there are symptoms associated more with the angle closure type and with the open angle type. It is very important that patients be seen in the clinic because otherwise the likelihood of the condition being missed is very likely.
Usually it's 40 and above, 40 years old and above.
Generally, it is a condition that happens in the upper age group. But you know, there are children that are born with congenital glaucoma. There are young children that also have glaucoma, but these are not as common as those in the 40s, in the 50s, or in the 60s age group.
Well, there are basically three types of treatment, no? The most common is topical eye drops, no? So we have different eye drops that could lower the pressure. Well, we have eye drops, we have laser, and we have surgery to control or to slow down the disease.
Depending on the type of glaucoma, depending on the severity of the glaucoma, that is where you will pattern whatever treatment plan you would have per patient. You know, patients are treated differently simply because their glaucomas are very different in terms of causation, in terms of severity. So you will have to tailor fit your treatment for what is in that particular patient.
Well, the main concern of the patient is if they will have vision until they die or in their lifetime. It depends, no? If we catch them early, well, there's a high chance of preserving the vision. But if we got them at the later stage or an advanced stage, it's very difficult to promise we could preserve the vision.
As we established earlier, glaucoma is a lifelong disease, and therefore its treatment is also lifelong. Glaucoma has no cure. Okay? Despite all that we know today, despite all that we have today as far as treatment is concerned, it is only to control the disease, never to take it away, never to cure it. And therefore, that concept has to be well ingrained in any patient with glaucoma. They should never expect that their vision is going to improve. They should only expect that whatever they have will be maintained.
So sa glaucoma, may konting pag-alala. Hindi pwedeng pa-easy-easy lang, no? Hindi gaya ng cataract kanina, makakahintay yan, pwede yan next week, pwede yan next month. Sa glaucoma, kailangan matingnan na kaagad ng doktor, magamot na kaagad ng doktor, magawan na kaagad ng, well, treatment. No? Yun ang importante sa glaucoma.